online prescribing being embraced by doctors across the country, of course. But with these changes come significant risks of fraud, particularly with controlled substances. One company has found a way to make these transactions safer. We want to talk about it in a Fox Business exclusive right now with Imprivata Chief Medical Officer Dr. Sean Kelly. Dr. Sean Kelly, good to have you on the program. Thanks so much for joining us.
Thanks for having me, Maria.
Can you set the stage in terms of e-prescriptions and fraud? What do you see out there?
Sure. As the SureScripts report that just came out shows, with over 6.5 billion transactions per year in 2014, there's been broad adoption and comfort level with e-prescription in general for most substances, i.e. non-controlled substances. It's been a practice that's really been very widely accepted by not just physicians and nurses and other care providers, but actually by patients. It can be much more convenient just to go right to your retail pharmacy, pick up your prescription. For doctors, it's much better not to have your DEA number and other signatures and things out there on a written paper copy. So it can be very convenient, as is evidenced by those high numbers that SureScripts just put out. More transactions per year than Amex or PayPal even this past year in 2014. But it begs the question, since it's so widely adopted, why not use it for controlled substances, which are painkillers, opiates, sedatives, even some ADD and ADHD drugs, anti-seizure drugs. These are some of the most potent and powerful medications that we have and that we prescribe. They can do a lot of good, but they can also do a lot of harm.
Right. So obviously, doing prescriptions online and e-prescriptions has gone mainstream. I mean, it's being used. So what is the downside risk? And then I want to talk about the technology that you've come up with to counter that.
Sure. I think the short answer to why it has not been adopted as of yet, the short answer is that the technology was just very expensive and hard to come up with, mainly because of the very high standards put in place by the DEA back in 2010. Rightly so. It needs to be a very secure process, HIPAA compliant and auditable. That's a tall order. It really was not until the regulatory environment changed enough through specifically a few state regulations, like in New York, the iStop regulation that passed recently says that in March of next year, every prescription in that state needs to be put through electronically, whether that's narcotics and other controlled substances or not. This acted as a forcing function for a lot of major vendors like EHRs and e-prescription modules, as well as SureScripts and us, Imprivata. We provide the authentication pathway that calls out to all the interlocking technologies to go ahead and set up and put through that whole system, stem to stern, needs to be credentialed, auditable, HIPAA compliant. That's been a tall order. One thing about those numbers, I think only 1.67 million prescriptions went through last year that were e-prescription of controlled substances. Important to keep in mind, that's up 400% from the prior year. So I think we're at the beginning of an inflection in that curve, and the market is really about ready to explode on EPCS.
So tell us about that. What would be your vision in terms of the growth here in the next 5 years?
I think in order, like you said, before you talk about the specific technology, it's really important to understand some of the macro forces involved. We are in the midst of a public health crisis like we haven't seen before. As a practicing emergency physician, I see this literally every shift, at least 3 or 4 patients affected by this. We see death, morbidity, mortality. Right now in this country, this year, more people die from drug overdoses than do from car accidents. I really like this comparison because it's not like it's safer driving out there right now because we're better drivers. I mean, I just came in on through Boston traffic, and Maria, I think I saw many people multitasking on the road, using their devices and drinking their Dunkin' Donuts, and what has changed? Part of it is the regulatory and safety standards and policy making around safety in that industry, and part of it's the technology that allows safety in cars, in all of the products that we use.
Right.
This can be a similar thing that can happen with e-prescription. Technology can come to bear in a regulatory environment that's now ripe for it, and can help achieve safety in in a real public health epidemic that we have going on right now.
It sure
Just
is.
so you understand, so people understand the scope of this. In 2013, I believe it's 2013, SureScripts put out also that there were 234 million pain pill prescriptions written, enough for a whole bottle of pills for every single adult American. That's a staggering amount of medications that are out there in the world, and some of it's legitimate, but it's also leading people to heroin addiction and overdose, and so it really is a public health crisis going on right now.
It sure is. Dr. Sean Kelly, thanks very much for joining us. We'll see you soon. We appreciate your time.